Before the success stories, the progress, there was you. You who made a choice to grow, to inspire, to overcome your own challenges. At NASM, we're in service of your limitless potential, because when you keep growing, we all get stronger, and we'll never stop making your journey our mission. Join the fitness leader. Become a fitness leader. Become a certified personal trainer.
You're listening to the Peak Physique Podcast with Andre Adams on the NASM Podcast Network.
Hey, what's up, guys? Welcome back to the Peak Physique Podcast. I'm your host, Andre Adams, NASM Master Trainer and IFBB Physique Olympian. Today, we've got a very special topic. This is actually going to be a first for our show here, but the topic for today is going to be stem cell therapy and benefits for physique and bodybuilding athletes. Now, today, we're going to discuss specifically mesenchymal stem cells, or MSC therapy, and those benefits as they relate to physique and bodybuilding athletes. We've got a very special team who I'm going to introduce in just a moment here. And our team is going to share some case examples, answer some commonly asked questions about stem cell therapy, and explain those potential benefits of MSC on different organ systems for anti-aging, rejuvenation, overall wellness, and of course, physique and athletic performance, right? With that said, welcoming to the show, I'm going to start with, we've actually got three guests. This is the first time on our show. We're going to start with Dr. Miguel Romo out of CB Medical Center. Welcome to the show. We've got Dan Brown, one of the patient advisors for RCB Global and CB Cells Laboratory and Biotechnology, as well as another advisor, Carter Grant. Welcome, guys, to the show. We're excited to have you. Thanks for taking time out of your day to join us.
Perfect. Thank you.
Right. So let's kick things off. Maybe Dan, I'll probably start with you. Let's give our audience a little background about, stem cells in general, but also more specifically your group, your function, your role, how you guys got to where you're at today, and what makes you a leader in this particular field.
Perfect. Yes. So the star of the show is Dr. Miguel Romo. While mesenchymal stem cells is maybe a new topic in the United States, it is not new in Mexico. Referred to as células madres, or the mother cells, and been operating in Mexico for well over 20 years. Laboratory in operation for well over 16 years. Miguel has quite literally treated thousands of patients. And I started out as a patient of his. And, in Mexico, it's commonplace. And so they're treating thousands of patients per year, and there is an increased demand for international patients. And that's kind of where Carter and I come in. So I started off as a patient. I started referring a lot of people. And then it essentially just worked as a good common ground of, hey, there's a lot of these questions that Americans have that are very simple and basic and kind of like a pre-clearing question. What is a stem cell? What does it do? Type of thing, and very valid questions. And a lot of those can be kind of exhausted at our level, so that, once we put you in front of Dr. Romo or one of the other world-class physicians, it's more targeted to exactly what it's going to do for you. And what we can facilitate and where you're going to do it. So that's the gist of that.
Excellent. And you guys have, remind me, you have facilities throughout Mexico. Maybe also talk about the one that just opened up, right? You guys have some new things going on. Where is your main facility located at, and which one do you guys recommend for people coming from the U.S.?
Right. So the target locations for American patients now going to be here, right here at the border, about 600 feet from the border, in the New City Medical Tower. Very convenient. Patients can often, stay on the U.S. side and seek treatment here. But the laboratory itself is in Guadalajara, Mexico. There are 2 clinics there in Mexico, and that's where it's primarily operated out of, as well as Puerto Vallarta. And that's where we've been for the last several years. And we were originally introduced with Dr. Romo and been working with him. And a lot of it is the number one thing with seeking stem cell therapy is, number one, the quality of the source of the stem cells, a regulated COFA approved laboratory. Number two is the quality of the physician administering it. someone that has years of experience and specialities within the mesenchymal stem cell space. And then number 3 is where you're going to get treated. So oftentimes you'll see with clinics operating throughout the world, their primary focus is just the clinic location. You'll have just this beautiful clinic, but what you don't see is behind the scenes, there's a laboratory that doesn't have the experience level, or physicians that are kind of just getting their start and, kind of doing a little bit backwards. They're spending a lot of money on marketing to try to drive it to these new laboratories, whereas this is really the opposite. This is a laboratory that's been functioning at a high level, for 16 years, and now it's just being brought to the table for American patients to seek it. And Tijuana is now the new location. I mean, again, you hear negative things about, say, Tijuana or things like that, but the reality is this is the hub of medical tourism within Mexico. Very close to Southern California. You can fly domestically into San Diego. A lot of those things you hear, they're not true. A lot of those stories from decades ago. I live here personally now. 2-year-old daughter and my family regularly go throughout town. So I want to preface that some people are concerned with, coming to Mexico and seeking medical treatment abroad. But, it's been operating in Mexico for decades. And we're just fortunate to get to work with Dr. Romo and now here at a more convenient location.
Excellent. And, that was one of the things, Dan, that stood out to me. I think our first conversation, and this would be good to point out for our audiences, some of the differences of why is it attractive for, U.S. people to potentially look at treatment in Tijuana and Mexico versus trying to do something with stem cells here in the U.S. Things like how many cells per treatment, the cost, and all these things. I think let's start there. Let's kind of define what is the difference of stem cell treatment such as yours in Mexico versus a typical option or treatment plan here in, the stateside.
Right. So typically in the United States, the most common is going to be adipose tissue or bone marrow derived stem cells, and they're not cultured. So, you end up with a very low amount of stem cells in the first place. I originally started doing stem cells after I medically retired from the Air Force, and I did them with the Veterans Affairs Office. I had decent results with it, and I wanted to continue that. And actually, someone at the VA said, Dan, you spent so much time overseas in the military, you really ought to look at going to Mexico to seek treatment. And I was asked why, and he said, they have more of them and they're cheaper. That was enough for me to, make the trip after what I'd seen in the States. But then I really got to find out, what it was. And then when you're down here in Mexico, they're cultured umbilical tissue mesenchymal stem cells. And you can hear umbilical tissue cells being used up in the United States, but they're not cultured. And that seems like a very insignificant thing, but it is the most significant. When you are culturing the cells, only live cells will culture. And we are administering them within 72 hours of culture to maintain that viability. And so in the States, whereas you might just get a few million for tens of thousands of dollars, if and when you can find them, we can do upwards of 300 million cells in IV, typical joint injections, as many as 50 million for less than half the cost. It's just simply the logistics of getting here. And now being at this location, it's going to be more convenient. But I'll let Dr. Romo go in now a little bit more about mesenchymal stem cells in Mexico versus the United States, I think.
So it's totally different. If you get stem cells from adult tissues, and if you compare with mesenchymal stem cell for young tissue like placenta and umbilical cord, it's totally different. Better quality of the stem cells than stem cell for adult tissues. And for example, if you get a biopsy from bone marrow, less than 0.01% of the cells are mesenchymal stem cells. It's thousands, not millions. Here in Mexico, you can cultivate and you can get better quality cells and more cells. You say the right way, we can put, for example, IV 300 million of mesenchymal stem cells. And if you get the biopsy of your bone marrow, we need to weigh more or less a month, and it's impossible to get more than 10 million, usually 1 or 2 million of stem cells. That means you can get better results, better success with the treatment with stem cells from umbilical cord or jungle tissues.
Right. And that is the short answer of it, is that oftentimes with certain injuries and damage you have, from whether it's musculoskeletal or organ damage, it is a numbers game, so you have something that you have a several 100 million mesenchymal stem cell issue. Just putting 10 million in there, it's going to be better than nothing, but it's not going to be what you need. And you can pay 2 and 3 times the price to do that in the United States, when the reality you can come here and get 10 times the stem cells for half the price. But one thing I do want to touch on real quick is there is oftentimes a confusion when you say the word stem cells. It was more common in the past, but they try to associate mesenchymal stem cells with embryonic stem cells. These are not embryonic stem cells. There's no harm to mother or baby. Do you want to go into that a little bit?
Yeah, it's totally different. Actually, the embryonic stem cells is not legal because one of them is you need to kill an embryo, forget that stem cells. And the other thing is a lot of researchers find that cells could get tumors, teratomas and teratocarcinomas. I don't know if it's similar in English.
Mm-hmm.
That is the reason, like 20 years ago, is no legal use embryonic stem cells.
Right. So that just wanted to clear up that confusion. Oftentimes, if you go on message boards and things like that, and you'll have popular podcasts or athletes, things like that, say, "Oh, I'm going to other countries to do stem cells." I'm like, "Oh, aborted fetuses and all this negativity." That's not the case with this. So Dr. Romo, his specialty is he's an OBGYN. So his specialty was as an OBG, and he worked on facilitation, not only extracting the placentas and the umbilical tissue, but then worked in the laboratories in the summers while he was going through medical school. So his experience level is really second to none in this industry. The United States is in that regard really behind the curve, versus Mexico has made leaps and bounds ahead due to the way socialized medicine versus capitalist medicine in the United States is structured.
Correct. Right. And that's a good point to hit on, for our audience, just kind of high level. We won't go too deep into it, but, if you think about the U.S. healthcare system, right, if we can, let's say we're talking, cartilage in the knee, right, if you can replace that or, go through different treatments with your orthopedist over several years, financially, obviously, that's going to cost you more money. You're paying more money in the system, right? Versus if you can get a higher dose, more effective treatment with something like stem cells and potentially regrow and repair that tissue fully, that could solve the problem, right? So it's just two different approaches. And I think that kind of reveals itself too, right? And that's why you see a lot of US residents seeking some of these higher, more effective doses of stem cell therapies in other places like yours. Now, with that being said, I think, and that's great too, because I think this really helps lay the context and the framework for some of these commonly asked questions. And just for you guys that are tuning in, a lot of you guys have sent me these questions over the last few weeks. So I'm excited to hear the answers to a few of these. And guys, I'm going to try and cater these more towards the physique athlete. But again, these are not just for physique athletes. This is for everyone. But obviously here, we want to also think about considerations and benefits, especially downstream for physique and bodybuilding athletes. So I'm going to start with, let's talk about what are the options of modalities of treatment. The most common, I think, and you guys correct me if I'm wrong, is the IV drip therapy, right? So IV injection of the stem cells. But what other mechanisms do you guys have? And I know if you've got a specific organ system, let's say you've got, a failing liver, you've got issues with the kidney. Are you guys able to do direct treatment for specific organ systems?
So I'll preface it and then let Dr. Romo go into more detail. But essentially, you're going to do, depending upon what type of issue you have, either a single or a combination of 4 treatments. So number 1 is an IV, which is for systemic issues, organ issues, autoimmune conditions, healing your heart, healing your lungs, healing various tissues, your vascular system. That's number 1. Number 2 is going to be a direct injection. So typically we have poor vascular flow to certain joints in the body, and you need to directly inject those stem cells. So for example, a knee treatment, an ankle treatment, a shoulder, musculoskeletal is a big one. The third is going to be more for brain-related issues or nerve-related issues, such as peripheral neuropathy for, say, diabetics, or even up to including like multiple sclerosis. It's a very common treatment. By putting the stem cells in the spinal fluid, we are able to bypass the blood-brain barrier and get those stem cells directly there. That sounds scary. It's actually a commonplace treatment. I've quite literally witnessed thousands of patients. I've worked with a couple thousand patients myself with Dr. Romo. And, it's an injection performed by an anesthesiologist. You're not sedated, but, you are in an OR with an anesthesiologist because it's a very commonplace treatment for them. It takes less than 5 minutes. They inject them into your spinal fluid, and, it's similar to any other treatment. And then the last is going to be nebulized sessions. Typically, going to be for something like COPD. That's where you're going to breathe in the stem cells. So that's the 4 main types of treatments and the way we administer them to get them in the body. It's the same mesenchymal stem cells. It's not like, oh, there's a heart stem cell, there's a lung stem cell, there's a liver stem cell. Mesenchymal stem cells, mesenchymal stem cell. We just have different ways to administer them. And then I'll let Dr. Romo go more into like mesenchymal stem cells, and then also if you want to touch on exosomes and maybe natural killers.
Yeah, of course. So the main treatment with the stem cells is the mesenchymal stem cells, but we have as well the exosome from mesenchymal stem cells. The exosome is like a booster for the stem cells. It's a really good complement, more when we want to treat some diseases like brain disease, like kidney problems and liver problems. And on the other hand, we have special cellular therapy for cancer. It's with NK cells and
natural killer cells.
Natural killer cells is for cancer and for virus infection, like herpes or something like that. But in general, if we want to repair and regenerate our tissues, the main is the mesenchymal stem cells. You want to treat virus or cancer, NK cells, and we want to treat brain problems or kidney problems. It's a really good idea combine with exosomes from the stem cells.
Excellent. I love it. There's so many different options and ways of combining these and you guys actually touched on 2 of my questions, which were the exosomes, the purpose, function, when would that be used? And then the other one was, are they always the same mesenchymal stem cells, or are there different cells for different organ systems? And you guys answered both of those questions. So excellent stuff there. And, dive right in for the physique athletes, because honestly, Dan, when you and I first chatted, it's very enlightening, and it also gets me very excited, right? So I'll kind of frame out why this would even be important, in my opinion, for a high level physique and bodybuilding athlete. For all you guys that are bodybuilders or you follow sport, obviously, whether you're natural or enhanced, right? If you're using exogenous hormones, in any case, just from the intensity and the stress and strain of contest prep on your body puts a lot of additional stress and strain on various organ systems through the body. Obviously the heart, right, with the left ventricular hypertrophy issues, high blood pressure can cause kidney damage, all the way through different organ systems throughout the body. And, maybe when you're 20 years old, your body's very resilient, right? The blood vessels have a lot of elasticity. You don't even notice it. But when you're 30, 40, or 50 years old and you've been, doing something as strenuous as a bodybuilding prep for many years, or using exogenous hormones and supplementation for many years, you can really strain these systems. So for us, when we think about life after contest prep, or we think about, just that quality of life, minimizing risk of downstream issues later on in life, this is where I think we can get the most benefit out of something like stem cell therapy. So Dan, I'm going to have you guys, let's talk about most common method, right, with the IV drip therapy with stem cells, and walk us through how those stem cells make their way to the body and what benefits that could hold for the physique and bodybuilding athlete.
Do you want to take it?
So thanks again, Andre, for having us. I'm going to basically, if I can, simplify it. That's really what my role is once you've spoken to Dan and or Dr. Romo and you made the decision to visit, I'll just make it as simple for that patient as possible. For example, I'm a type 2 diabetic, and I naively came down to get stem cell treatment initially because, well, I needed to treat my pancreas. And naively, I just simply thought that the stem cells would go directly to my pancreas. Somehow, someway, that's just what I thought when I came down. Turns out, stem cells, they go primarily through the heart and through the lungs, and then they're going to gravitate elsewhere throughout the body. and they're just going to best assist with rejuvenation. And also at the same time, they're going to reboot your autoimmune system. So when patients tell me, well, Carter, I don't have an autoimmune condition diagnosis, I say, well, how great is that? Because in the end, right, we're going to die if we die of natural causes of a complication of an autoimmune condition. If it's not the heart and the lung or the brain, it's going to be something. So when someone says, I don't have an autoimmune condition, I say, well, that's fantastic, because preventative treatment is going to be much, much less expensive always than maintenance treatment. I fall into the category of someone that's been diagnosed. I would never credit exclusively my stem cell treatment. I had to make some dramatic life changes in my nutrition and my exercise. And so someone that says, I have an autoimmune condition, and they look at the heart or the lung or whatever issue they may have going on, it's important for that patient to know a mesenchymal stem cell is a mesenchymal stem cell is a mesenchymal stem cell. It's an all-inclusive protocol. If you have a heart issue, 300 million IV. If you have a lung issue, 300 million IV. Type 2 diabetic, 300 million IV. It's going to basically be the best case protocol for anti-aging, for autoimmune condition diagnosed, anti-autoimmune condition diagnoses, and anything you could think of is going to be best case scenario for IV. I also used to own and operate a CrossFit gym. And so I had a lot of wear and tear on my joints. I've had my knees done. It's a really good solution to treat the knees, hips, shoulders, elbows, wrists, for anyone that's just into fitness, broad general term speaking. And obviously patients come down to us to avoid having to get replacement surgery. In the United States, to simplify it, there's no money in happy, healthy people. They just want, and by the way, I'm American, obviously, maybe that was pretty obvious, but English is my first language. And so that's another barrier of entry. When you're coming into Mexico, we spend like half our time helping people understand that it is safe here. It's not unsafe here. The propaganda is pretty aggressive in the States. And so we spend the majority of our time just helping patients understand it's safe to come down to Mexico. Literally, like, that's the hardest part of our call. Most of the patients that I speak to have already made their decision. I just help them simplify being here, getting here. And I walk them through the logistics. I walk them through accounting. It's pretty straightforward once they've made that decision. But again, there's no money in happy, healthy people in the United States. And that's obviously not perfectly accurate across the board. But broad, general speaking, that's why patients are seeking alternative medication and treatments here in Mexico. Panama is another fantastic location. Colombia is another fantastic location for where we can do what we can do here in Mexico. But we were that with Dr. Romo in the second largest laboratory on the planet. Currently, we're producing 10 billion stem cells, the laboratory, and for over 200 patients per day. Dr. Romo technically has oversight on all of that. And in addition to that, he's educating well over 500 doctors throughout Mexico that are administering CB Cells Laboratories stem cells. So if someone's made that decision after talking to Dan or talking to Dr. Romo, and they're ready to make that decision, it's my responsibility to just keep it simple, keep it short, keep it sweet, and make it happen.
I do want to.
So, go ahead, Dan. Chime on in.
I just want to circle back a little bit on, say, the performance enhancement side of things, because I think that is a common question. So usage in my past as well. Mine, not in the sense of like a physique competitor, but I was in the military. So I had pretty reckless oral steroid usage when I was younger. I first came in from musculoskeletal issues, and then I became educated on what it could do for my organ systems. And looking at my blood work, I was essentially pre-diabetic. I ran growth hormone at high dosages when I was younger, recklessly. Again, this was 15 years ago when there wasn't as much education online. Most of the time, unsanitary conditions in the military. So typically, we're not doing injectables. You're in the middle of the mountains, and so you're doing mostly orals and heavy oral usage for months at a time. 6-9 months of heavy oral usage. So again, it was more for I was on the performance basis, and I didn't worry about it because I was a very young man. As I was getting older, treating joints and looking at my blood work, and it had markers that were off. I just thought, that was the cards I was dealt. I was going to deal with this as I got older, and I made that decision. And then I was educated by Dr. Romo and said, no, we can fix this. And so, for example, of healing that, kind of preventative, I didn't wait until I became full-blown diabetic by doing these IVs. I've got my, fasting blood sugars down in the 80s, without any other, I don't have to take metformin, I don't take insulin or anything like that. Just a matter of healing my pancreas with the stem cells. Typically, I always showed like elevated liver enzymes. I saw that improved, and I see that as commonplace with a lot of athletes that, hey, we're all going to pass at some point or another, and we enjoy our lifestyles when we're young, but we start really thinking about it later in life. And this is really the best opportunity to, heal your bodies, and not just in the sense when you're post-career. A lot of people really start waiting later on until they're post-career, and they're like, oh, I've got all these issues, I'm going to have to retire. And the only reason they retire is they run into a health problem that doesn't allow them to keep doing what they love. We're not here to choose or tell you how to live your life. It's more those that we have guys who are like, I would really like to compete for another decade. This is a fantastic opportunity, I think, patients, besides treating musculoskeletal issues, but if, say in your off season, when you're lowering your dosages, if you'll come in and do a stem cell therapy, it's going to go a long way in healing up some of that damage you did, in mid-season at the higher dosing. And so, then you're going to be able to compete for much, much longer, and take your physique to, a much higher level. So I just wanted to touch on that.
No, that's great information, and definitely something that I think everyone on this planet should be thinking about, but especially when you know that you're putting that kind of stress and strain on these different organ systems in the body. So, if you think about helping resolve different issues, like you said, Dan, with maybe some insulin resistance, the onset of kind of pre-diabetic, some autoimmune issues. And what a lot of people don't recognize is that all these systems in our body are connected, right? So if we think about even our capacity to burn fat, and you think about thyroid hormones, with a lot of that conversion taking place in the liver, well, if we can make the liver function more efficiently, do some anti-aging rejuvenation through the stem cell therapies, then we're also enhancing our ability to burn fat and, improve insulin response and a lot of these other downstream benefits throughout the body. So definitely important. And I love that, the stem cells are truly an anti-aging therapy, right? We've got other things that maybe slow down the aging process, but we're able to actually rebuild tissues, not just skeletal muscle, type issues, but rebuild organ system tissues as well. One question I have for you guys too is, how do you determine how many stem cells to inject? And is there a maximum, or is there a risk of overdoing it with stem cells?
So usually depend how the weight of the patient. In general is in kilos is 1 to 3 millions per kilo or 1.4 per pound. And IV, you can get the highest dose is 300 million. You can get more. Actually, the risk is minimal. And usually the risk is a little headache, a little palpitation when you get the IV, but it's very, very rare. The mesenchymal stem cell therapy is very, very, very safe. So, but more than 300 IV at the same time is not really different. 300 million is the highest dose. You can get later again the treatment in 3 or 6 months, but more than 300 million at the same time IV is not necessary. You can get IV, you can get joints at the same session, and intrathecal or another kind of treatment, but IV 300 million is the highest dose, and it's very, very safe.
Andre, I'd like to share a story, if I may.
Sure.
So I actually had a patient. We ultimately had a patient, but I had first contact with him, and he said, Carter, I got a problem. I was attacked by a bison. And at first, I really just didn't believe his story. It was pretty intense. He said he was gored by a bison, was launched in the air. He could actually see the top of the barn. And immediately my eyes just kind of, all right, we'll just settle down on this call and see what happens. He later tells me that he wants to get his ankles treated, his knees treated, his hips treated, his shoulders treated, his elbows treated, his wrist treated, his lower back, his middle back, his neck. And he also wanted a 300 million systemic IV and some other treatments I can't mention to you here on this podcast. But this testimonial is actually on our website. Patient's name is Jim Carter. Coincidentally, obviously we have the same name. And so I was listening and I said, okay, well, here's the total cost of that package treatment. It was quite high. And I just by default imagined it was probably maybe out of his price range. And I said, you have to book your flights, book your accommodations before I can get you on the calendar. And sure enough, he did. And he called me back and said, check. I checked and he sure did. So started the process of scheduling him and getting his MRIs done and getting him in for treatment. And then the total stem cell comes up and he says, Carter, why did we only do 975 million mesenchymal stem cells? And I looked at him like, I really didn't know that was the objective here. But he was actually asking, what is the total amount of stem cells I can receive? And Dr. Romo confirmed, you're totally fine. It's totally normal, totally natural. You just happen to have a lot of treatment necessary. And then it was about 6 months later, he gives me a call and he says, Carter, I want to come back. And that's not common to come back at the 6-month mark. He just literally claimed he got his life back. And so he couldn't afford not to come back and get treatment. And I said, well, I can't stop you from coming back. I just want to let you know that for financial reasons, patients might want to wait a year, 3 years, or 5 years. And he kind of cut me off and said, that's not the problem. He just is in a different situation financially. And I said, well, may or may not be the unofficial Guinness Book World Record holder for most stem cells. And he sure enough came back down and done 1 billion stem cells. He's been back twice more. He's probably now done cumulatively 4 billion stem cells. Now, this is obviously an anomaly, but he's on our website. There's a really nice testimonial. He shares his story. It's pretty elaborate. I mean, he just wanted to change the way he aged, and he just needed and wanted a lot of help.
Yeah. No, that's incredible. And that actually speaks volumes too, right? To what is the maximum amount of stem cells. So you guys have your recommendations, obviously, but I think that's, good context or good reference point for sure. Guys, if you're just joining us, this is the Peak Physique Podcast. I've got our special guest on. We're talking about all different types of mesenchymal stem cells, CB Medical laboratories. And, we've still got quite a few questions I do want to get through here. And you touched on some of them, Carter. So let's maybe recap. One of the questions that I was getting from my following were typical length of the procedure. And I know that's pretty quick. And then kind of the cadence or frequency that you guys normally recommend for the average treatment.
Yeah. So let me just elaborate a little bit more and then I'll hand it back over to Dan and Dr. Romo. So typically for a treatment, best case scenario, truly, it is a one and done here with us. That's everyone's best case scenario, because typically a patient's going to go back and, they may or may not feel a moral obligation to share that story with someone else. That's the difference, in my very biased opinion, of coming down to Mexico and getting treatment versus, what's offered to you in the States or Canada or elsewhere for that matter. But the reality is we really want you to be fixed. We want to treat the problem. We want to change the way you age. But again, if you're going to get, for example, your knees treated, I got my knees treated a year later because, I'm still on my knees. I'm still using my knees. My knees are like brake pads. They're going to have additional wear and tear on them. Again, hopefully best case scenario, it's a one and done treatment. It really just depends on the patient, their needs, what they want, what they're feeling, the life they want to continually live. We really don't know what these patients are doing once they leave the clinic. So it's really just a matter of what the patient wants, what they need, and what fits within their budget, I guess, is the only real restraint with stem cell treatment. But typically, they're going to come down and get treatment. And, if they're getting the joint treated, we want them to rest, recover for about 2 weeks. But if it hurts, stop doing it. If it feels fine, keep doing it. It's kind of hard to pinpoint everyone's recovery process. The systemic IV is, again, like I myself, as an autoimmune condition patient, I'm fighting for my life. Someone broad general has an autoimmune condition. They feel constant fatigue, chronic fatigue, like they're riddled with inflammation. And, myself, like I get treatment once a year because, I can, but the reality is that, if you're going to get a joint treated, probably going to need to come back, depending on the scenario, another visit, maybe at the 3 or 5 year mark.
Right. So a bit of preventative maintenance there, in addition to treating any acute issues that might already be present in the body.
Yeah, and then Dan hit this point, but we have some patients that come down and get their IV treatment, because they can't afford not to. I mean, it's just such a phenomenal response, and before some patients come down, an autoimmune condition, they're fighting for their life, they make life changes. Some patients, well, they just say, Carter, Dan, I just want to continue to live my life. I want to continually abuse my body or whatever they want to do. And we're not going to be able to stop them from getting treatment, but it kind of is like a 50-50, patients that are fighting for their life, patients just want to continuously live their life. Yeah.
You think anti-aging in general has become extremely popular, right? It's, people will do all kind of different things, whether it's IV drip therapies, in this case, stem cells, but just different things that, hopefully prevent the body from aging. So I think you've got the issues where someone's treating a very specific condition or ailment that they're trying to heal the body from. And then you've got those preventative, especially if you've got, the disposable income to be proactive about aging and overall health. So, ideally, in an ideal state, you'd be able to do both, like you said, and just preventatively at some certain cadence, maybe it's 1 to 3 years or 5 years, you're just doing those treatments just to slow down the aging process. So I did have some very specific questions come in too that I would love to pick your brain on. Dan, I don't know if you had a chance to take a look at either of these, but I had actually 2 of my followers that had a little bit more specific conditions. Then they were just curious, is there a benefit or a risk for treating something like MS, right? So multiple sclerosis. Is there any benefit to doing something like these types of stem cells? And then the second one was scleroderma, which I'm not even as well versed or familiar with, but I figured I'd throw them out there if you guys had any experience or thoughts off the top of your head.
We'll start with MS because it is a very commonly treated condition with mesenchymal stem cells. Just me personally, hundreds of patients per year, laboratory, thousands of patients. There's a lot of published medical research regarding treating multiple sclerosis, lesions of the brain, but also secondary conditions such as neuropathy, demyelination of the nerves, and even up to and including something like drop foot. That's a very common one. And then also sometimes loss of voice. A certain case sticks out to me. I'd love it if she watched this one day. Her name is Missy Rena. She's from Chicago, Illinois. And when they first called, I had to speak with her husband about her MS condition. And I was kind of earlier on working with Dr. Romo, and I primarily had worked with, veterans that were having mostly musculoskeletal issues and some organ issues. But I was working with him, got a call about MS. I'd educated myself on it. I was explaining it to her husband. We explained the process and what we could do. And we brought her down, and she did an intrathecal, an IV, and then she also did some direct injections to her foot because it's a condition called drop foot, where they basically loss of function nerves to where, they quite literally drop foot. They can't pick up their foot. So she did that. And, of course, we're following up months later. And then I randomly got a phone call from a number I didn't have saved because I talked to her husband. And now, mind you, it wasn't just a crystal clear, absolute perfect, never had an issue voice, but it was quite strong. And, and I was asking who this was, and I was like, oh my goodness, is this Missy Rena? And she's talking just elated. I mean, I could, visualize the tears in her eyes. She had, improved her speaking ability by more than 60%, where she had essentially been mute just about a few months prior. And, I make a joke. Her husband, Robert, was like, yeah, Dan, I can't get her to shut up now. So it was a very excellent meeting. And then, she came down again at the year mark and did treatment again, and she's continuing to make progress. And I would say in her case, for someone that had struggled with MS for, more than 20 years, she's made more than 80% improvement. Again, if we catch the condition earlier, you're more likely to kind of, mitigate those effects. And, but the longer you've had a condition and the worse you are, generally the more cells is going to be needed, the more treatment's going to be needed over a longer period of time. It's just the case. I use the example, healing is kind of like, building muscle in the gym. You don't, this isn't like cortisone injections or anything like that. You don't heal in a day. You don't heal in a week. You see, noticeable results in a month, pretty significant results in 3 months, dramatic results in 6 months plus, much like going to the gym, is that it does take time. And by putting those stem cells in your body, you're finally able to really heal yourself. And so I just want to touch base on that. This is not a medication. This is healing your body from the inside out. It's regrowing tissue. It's remyelinating nerves. It's healing inflammation. It's healing micro lesions in your organs, in your vascular system, in your brain. MS, just to go back to that, is, primarily diagnosed as, if I'm correct, lesions on the brain.
Exactly.
And so there's, besides our laboratory, just look worldwide in general of studies with multiple sclerosis and the reduction and healing of lesions of the brain due to MS. So that's, I think, sufficient information for MS. For scleroderma, do you want to go a little bit into that, Miguel?
So actually, in general, the autoimmune problems maybe is the main diseases to improve with the stem cells, because the stem cells helps a lot to regulate the immune system. And the normal treatment for autoimmune problems have a lot of side effects, and usually more than 50% of the patient need to stop to take the medicine because of side effects. That's the reason there are a lot of thousands and thousands of researches for different kind of autoimmune problems, like rheumatoid arthritis, like MS, like lupus, like scleroderma, and all the researchers show is really good option the mesenchymal stem cells because of that, because the mesenchymal stem cells interact with the different kind of immune system cells and regulate the function.
Also, do you want to go into a little bit of, in the sense that, regardless of this autoimmune diagnosis, type 2 diabetes, autoimmune diagnosis, multiple sclerosis, scleroderma, lupus, but, in the sense that the mesenchymal stem cells are intelligent by nature?
Exactly. Actually, the cellular therapy means that cells are alive. That means when that cell is going in your body, looking for the information, the data signals in the vitamin of the cells, and depend what your body needs is the way to the stem cell going to work. It's different with a medication, because the medication always going to work in the same way, and the cellular therapy is like a smart therapy because of that.
Andre?
Yeah, it's excellent. Honestly, it's fascinating just to hear you guys talk through, because I'm learning a lot too as we go throughout this process. And hopefully our audience that's listening, I encourage you guys, definitely check out the publications and testimonials, visit the website and reach out to the team. We'll be sharing their contact info at the end of this. The last question, I know we're running a little short on time. The last question I do want to just kind of leave our audience with, and specific to things like sports-related injuries, let's take some of the common ones in bodybuilding, right? We've got rotator cuff issues, very common. Obviously, knee issues, meniscus issues, or things like a pec tear. Would you recommend just sticking with, direct injection of the stem cells by themselves, or combining those with like stem cell plus PRP therapies, which I've heard about? What do you think would be the best treatment for a very acute sport-specific injury like this?
I'll let Dr. Romo answer.
So I think the stem cells are the main therapy for that. You can combine with PRP or another kind of growth factor therapies, but it's totally different. The main is the cellular therapy, because the cellular therapy is going to be working in your body for at least 12 months. And the PRP or something like that therapies is working at the just in one moment, and that's all. My recommendation is, if you want to get or combine both, you need to do it in different sessions, because sometimes PRP have a lot of fats, and that fats makes inflammation, and that inflammation can damage the cells. You can get cell therapy, for example, today. In 2 weeks, you can get good PRP, because you need to be fasting when you get the blood, etc. But the main is the stem cell therapy.
Excellent. Well, I'm glad I asked, because I think a lot of people are unclear on that. Dan, did you have anything else to add to that topic?
Yes, just to touch base on, say, something like, a pec tear, rotator cuff tear, something like that, is the significance of it being a partial tear. A full thickness tear, such as if you have a full thickness ACL tear, a complete detachment, mesenchymal stem cells are not going to go in there and reattach it. So that requires a surgical technique. Now, if you have a partial tear, which is generally the most common, especially with the rotator cuff pec tears and including the ACL, you can keep from having a full thickness tear and keep from having surgery by treating with the stem cells, treating that lesion and healing it up. So, you take some time off, you continue with your physical therapy, but I do want to make that point that it's not going to reattach fully severed tendons or ligaments. It does need to be a partial thickness tear.
Yeah, no, thanks for, just getting that distinction in there too, because I think that is important, right? It's no different than when people do, peptide therapies, or they're doing PRP. To Dan's point, if it's a full tear, it needs surgery. But, if it's a partial tear, there's a very, very strong chance that you can heal it with something like stem cell therapy and potentially avoid the surgery altogether. Guys, we are out of time for this episode, but I still think I have so many other questions for you guys. So I know we're going to have to follow up. But for our audience that's listening, let them know where they can find you guys, your website, anything else that you want to share to, help them get in contact with you.
Right. So the website is going to be cbmedicalcenters.com. That's kind of going to be a site that's more catered to English-speaking Americans. But at our disposal is we're kind of the front end. You'll kind of first touch base with us, send your email to that contact@cbmedicalcenters.com, and then we will essentially pre-screen, answer questions, and then we'll put you in front of a physician, whether it's Dr. Romo or one of the many quality physicians he oversees, and look at where your treatment location is going to be. Americans is primarily going to be here in TJ, but
Contact number.
Yeah, if you want to go with the contact number.
425-802-9377 and or your number.
706-633-7449.
We're here to help.
Excellent. All right.
Change the way you age.
That's right. You guys heard it here. So definitely make sure to reach out. If you guys have questions, you want additional case studies, case examples, testimonials, check out the website, reach out to the guys. Highly encourage you to even do your own homework and research on the benefits. And hopefully you guys learned something new about this type of stem cell therapy here on the Peak Physique podcast. Guys, if you have any questions specific for me, you can reach me at trainingbydre@gmail.com. Obviously, you can find me on Instagram, AndreAdams_official, or through our online website at AndreAdamsofficial.com. Until next time, we are signing off of the Peak Physique podcast. Thank you all for tuning in once again.